Dr. Christopher Sliva joins us from the Rockford Spine Center to fill us in on different back surgeries and most importantly recovery. Welcome, Dr. Sliva.
Good morning. Thanks for having me.
Absolutely. So first of all, at what point when someone has back pain do they resort to back surgery?
Well, many times when we see patients at the Spine Center, surgery is rarely, if ever, discussed on a first visit. The reason is there are so many things that we can do short of surgery. So when a patient considers surgery is when those conservative treatments fail.
So it is the last resort?
Many times it's a treatment of last resort, yes.
But if you do have to resort to back surgery, there are lots of new technologies and back surgery really has changed. Can you talk about that a little bit?
Absolutely. Over the last 10 to 15 years, there have been many advances in both our diagnostic evaluation of patients. For example, there are better MRIs, CT scans, and X-rays. There's also been improvements in non-operative treatments with physical therapies and injections. And lastly, there have been significant advances in surgical techniques and anesthesia, making it much safer for patients to undergo these procedures.
So if they do have to undergo a procedure, is it something they should be scared of, or is it something they can...
Well, you can come up with any number of anxiety-provoking scenarios for people who ultimately decide to undergo surgery. But what's most important is that that patient has a thorough understanding of their problem and that they have a frank discussion with the surgeon regarding what the problem is, what the treatment options are, and that they feel comfortable with that.
Right, and let's talk recovery for a bit. What's important for patients to do to fully recover after a back surgery?
Well, it depends upon the surgery. Many of the surgeries today can be done in a less invasive or minimally invasive approach. This allows for the surgery to be done oftentimes on an outpatient basis where there's a much less time of recovery. There's less muscle disruption and tissue disruption, which allows a more rapid recovery. But during that process, it's important to take it easy for a few days, let your body recover, and then follow your doctor's orders as far as how to proceed through the recovery process.
But in most cases, full recovery is very possible, right?
Well, that's a case-by-case basis.
Right.
There are many patients who can return to a normal or a more normal lifestyle after a spinal surgery.
But obviously the Rockford Spine Center could help them with that recovery process.
Absolutely. We spend a great deal of time counseling patients, make sure they thoroughly understand what the risks and benefits are, and certainly what a typical recovery course looks like.
Sounds good. Well, thanks for joining us today, Dr. Sliva.
Thank you.
And in your medical news, television in